Welcome to another episode of Innovation Somalia. I am your host Abdullah Ali. I'm coming to you from Columbus, Ohio. I'm really excited. Today's guest it's Marion Thompson. Marion is Public Information Officer at Franklin County Children's Services. Thank you so much for taking the time.
Thank you for having me.
I appreciate it. And thank you for reaching out. Public Information Officer for Franklin County Children's Services. That seems a big title. So tell me a little bit about the title, a little bit about what you do.
Okay. Well, I am responsible for community outreach.
Okay.
That would include managing some of our website content, our newsletters, public speaking engagements, and various events where we go out in the community to try to spread the message of children's services.
How did COVID-19 affect the service that you guys provide for the community?
Well, COVID-19 had a great impact on the services that we provide. We did find that the number of cases that were being referred to us was reduced because a lot of the cases come from schools and other places where children go frequently. So since children were not in those places, there weren't as many eyes on them. So we had to make an effort to get the rest of the community involved in recognizing when families are in need and letting us know about that.
How did you outreach that to the community? Was it like through type of communication or like how did that work? Tell me a little bit about like how did you do the outreach to the community since there wasn't many eyes on the children's or the number of giving you heads up kind of sort of dropped. But how did you kind of like basically what did you do to fill up that empty vacuum?
Okay, well actually since many things were closed and many avenues were closed to us, and we were ourselves working remotely, we had to rely a lot on electronic means through social media, through our website content, through our newsletters, and having some pamphlets at different locations where people could pick them up. We provided resources for families that they might need during COVID.
What kind of resources at the time?
We provided things like what to do if you come down with COVID, what sort of planning you need to make for your children, advising people that they need to have a designated caregiver for their children in case they were not able to care for them. Things of that nature.
What about those that were actually in need? The ones that we feel like, hey, they might be, they can use some sort of help, and nobody's just, getting that information to you.
Well, once we did receive information about referrals for child abuse and neglect, our caseworkers were still on the front line, still visiting families, still doing investigations,
even during the COVID-19?
Yes.
That seems like a tough spot to be in terms of like providing services.
Yes, it is. It was difficult, but we have a lot of really wonderful caseworkers who go above and beyond requirements to make sure that the families have what they need.
In Franklin County, I lived here for like about 25 years. Since then, it seems like Franklin County just kind of sort of growing a little bit, or the population clumps growing. Now, how do you provide services for the different type of community, like immigrant community that is, right? There's my community is Somali. There's a large population that in here. There were recent community that's also getting close to, which is the Nepalian community. So how do you provide services or how do you do the outreach to kind of make awareness to those different type of communities?
Try to provide a lot of our materials in various languages, and we try to send those materials like resource guides, different parenting tips and things like that. And some of those we have translated in other languages. Oh,
okay. So what does that communication pipeline looks like? Like how do you get in front of that community?
We have contacted various agencies that are in the Somali community, like Ethiopian 𝐇𝐎𝐏 support services, CRIS, etc., and we've sent them materials.
Okay.
We also have different resource fairs that we attend throughout the community where we're out and available to speak with people from all different walks of life about parenting tips and other resources that we can provide.
How is that working out? Is it well received in terms of getting to the point, or how's that working out?
Well, of course, there's always more work to do, but I think we have been extremely busy this past summer. Since things have opened up, there have been a lot more opportunities to visit with the community and the public all over the city, and to provide resources to them.
So let's get into a little bit deeper on how if a child it's being neglected or some sort of an endangered at risk situation, how is a family come under the agency's radar?
Well, typically we'll receive a referral through our 24-hour child abuse hotline, which is 614-229-7000. Of some sort of suspected abuse or neglect, or a family that is in need of services. And if that referral meets the threshold of the Ohio Revised Code for our investigation, we will go ahead and open up a case and investigate that. If the family is in need of services, we can refer them to services in the community, such as mental health support, material assistance, food assistance, things of that nature.
How do you differentiate, a fake call or a fake situation versus a real situation?
Well, a case has to meet the standards that are outlined in the Ohio Revised Code for meeting the threshold of our investigation. In a case where there is some sort of an allegation of some sort of a physical abuse of that sort of nature, that is providing that meets the threshold of the Ohio Revised Code, we would go ahead and contact that family, just check and see what's going on. Say, hey, mom and dad, we want to check and make sure that your kids are safe. Okay.
So how many incoming phone calls that get serviced rather kind of sort of determine versus determining, oh yeah, this is just doesn't meet that qualification, just pass on to somebody, or pass on to other services that we think they might need?
Well, in 2021, we received approximately 29,000 referrals, and of those 29,000, about 13,500 were screened in for investigation.
Oh wow, that's a lot. That's large numbers. So since COVID, are you guys equipped to handle that, or in terms of because I know everybody's suffering, having the right people in the right job positions.
Well, we are very much in need of caseworkers.
Right.
The caseworkers that we have, as I said, are very committed and do tend to work above and beyond expectations to try to help the families that they serve. So we are always looking for additional caseworkers who can help us out.
Anybody who's listening to right now and feel like, hey, I can go ahead and help out, I have the qualification, where did they go?
They can contact our website, which is childrenservices.franklincounty.ohio.gov. Take a look at our employment section, and they can see a listing of all of the employment openings.
So what is the agency's vision for protecting and kind of a sort of reserving future children that might be in danger?
Well, our mission...
In terms of outreach, that is.
In terms of outreach. Our mission is to provide for the permanency, safety, and well-being of children in a way that honors their family and their culture and their community. And we do that by trying to support families and give them the tools that they need to keep their children safe in stable homes. Tell
me a little bit about the help that you guys need in terms of providing a volunteer or providing or kind of maybe getting involved in the agency and see what do they need help with. What kind of services did you guys need help with as far as from the community?
Well, we definitely need the help of the community in order to do the work that we do. One major way in which we need help is by having families who are willing to be foster families and provide loving temporary homes for children when they have to leave home. Our goal is always to try to reunite families and to keep them together, because we find that children have better outcomes if that's the case. And we try to keep them in their homes if it's safely possible. But if not, then we look to what's called a kinship situation with a relative or someone with whom the child has a relationship as a place where the children can be cared for. If that's not possible, then we do need to have temporary foster homes. So foster families are very much needed.
Okay.
Additionally, we have mentoring programs. We have our friendship program, our college bound program, and our African American specific Simba and Maleka programs that match youth in one-on-one relationships with mentors who just provide a positive role model and a committed contact for them for a long period of time so that they can have some positive relationships and positive experiences. And then we also have our agency's crisis center, where children are placed in times of emergency, and we have volunteers who help at the crisis center, and that's open 24 hours a day, 7 days a week. Also coming up very shortly, we'll have our Holiday Wish program, in which we ask the community to provide gifts for children who are under agency care, and they can also make donations to our Franklin County Children's Fund, which provides for special opportunities for kids that they might not ordinarily be able to take advantage of.
Okay. Dr. Ida, let's talk about a little bit about the long-term care for the foster parent. And also I want to talk about a little bit of the different age group that you know, is there like a different age group that for the one-on-one services that as a volunteer? You mentioned you need help from the community. So tell us a little bit about what you need help exactly with. From the Somali community, that is, right?
Well, we need the help of the community in a lot of ways. One way is by providing foster care parents. There are cases in which we do have to provide temporary homes for children when they can't be safely maintained within their current home. Our goal is always to try to reunify families, and we try to keep them together with as long as it's safely possible. But if that is not possible, then we do need families who can provide that temporary safe haven.
So let me ask you a little bit about the temporary part of it. So how does it work? Like, so temporary meaning 2 to 3 months, 2 to 3 weeks. How does it really work?
It really depends upon the situation.
Okay.
Families are given a case plan that they need to follow, and if they're able to follow that case plan, then hopefully they'll be able to be reunited quickly.
Okay.
Sometimes that's just not the case.
Okay. How do you protect the child itself from the family in which they are, you know, seeking a temporary help from? So, for example, like how do you even screen those parents to make sure that child doesn't go back to the same situation?
In order to become a foster parent, you need to become licensed. So you need to attend 36 hours of training, I believe.
Okay.
And you have to have a home study where.
So there's a pre-qualifications for that, for that family
Right.
to even become a foster parent. Okay, that's good to know. That's good to know. So continue. So if there aren't enough families that who can provide that, what else can the community do in terms of to kind of sort of like keep the families and the children for the long run?
Well, people can be supportive by becoming mentors and volunteers with the agency. Our mentors are matched with youth one-on-one in relationships.
Is there an age
them.
group on that?
Typically, they're about 10 to 17.
Okay.
For the most part. And we just ask that the mentor spends at least two occasions a month with the youth, and that they make a commitment of at least 1 year, just so that child has that positive role model and that person that they can count on.
Okay. So that's the mentorship program. So what is the kinship?
Kinship refers to when we have to take a child from their home. We first look to a relative or someone that they have a relationship with for them to be placed, and that's what we try to do in the majority of our placements.
So what is the process like? So you take children from their home, then and if there is no relative or somebody close up that have that relationship doesn't come forth, then what happens to that child?
Then we look for a foster home.
Okay, in between times, what happens where that child gets placed in?
That's why we have our intake and investigations crisis center.
Okay.
So if a child comes into agency care, our caseworkers and our kinship team and everyone else is working furiously and fast to find a suitable placement for that child.
So that temporary placement, tell me a little bit about that. Is that is that under the agency, or that is just something that it's kind of sort of, let's just say I'm providing that service and I'm kind of connected with the agency. The child has been taken from their home. There's no relative or somebody that have a close relationship with that child doesn't come forth, or there's none to say that, right? Then that child gets placed where?
They would be placed within a foster home, because we find that children do much better in home settings.
Okay.
There are some times when children may be placed in a group home or in an institutional setting.
Okay.
And that could be for a variety of reasons.
Yeah.
But for the most part, we do our best to make sure that children are with families, because that's where they do best.
Okay. So the kinship, that's when a family gets under the radar of the agency. Okay. No matter how you slice this, is just a bad situation to be in, really, right?
Yeah, it's a difficult
situation. Yeah. And you guys do a great job in terms of creating awareness, and in terms of wanting to make sure that family doesn't get under the radar of the agency, and trying to keep within their cultures.
Yes.
Yeah, and I think that itself, it's a step that's showing that you guys do care. And let's compare stats from before the COVID and after the COVID. 21, the numbers of referrals were decreased, or from 2019, I'm assuming, or they were up from 2019.
Well, in 2020. The numbers decreased to about 28,000, and that was primarily because of lockdown and people not being in schools or being where there are more eyes on kids. They increased again in 2019 as things kind of opened up a bit to about 29,000, and that is a little bit closer to what we have traditionally been seeing.
Okay. So if we were to dig into a little bit about my community, and I think we have some stats. My podcast is called Innovation Somalia. I'm originally from Somalia, and there's a large population of Somali here. How do you guys serve, especially within my community?
We try to be very culturally aware and culturally competent and responsive to different cultures. We have cultural training that our caseworkers and staff are required to attend.
Let's go back to the stats. The 33,000, do you happen to know how many of that were specifically Somalis?
And we had 1,952 children who were transferred for ongoing services.
1,952.
Right. And 1,703 children were placed in foster care. 118 Somali children received ongoing services from FCCS. 20 Somali youth were removed from their homes due to safety concerns, and 21 are currently in our agency's custody and placement.
That number, how many of that is being placed within their culture?
Fortunately, I don't have those stats.
How do we reduce that number?
I would say just having the community be aware of what the agency's mission is, having people aware that there are people out there who want to help if they're in need, and will make themselves available to people who are in need, would know that we are available as a resource to help, and that we are very respectful of different cultures, and we are willing to learn from different cultures, and that our mission is to protect children while strengthening families and giving them the resources that they need to be successful.
If you were to give like an advice to my community and directly having a conversation in front of them and the people that can make a difference in their lives are listening, what would you say to them?
I would say that we want them to know that we respect their culture, we respect families. Our involvement with families is intended to be positive. We want to provide families with the supports that they need in cases where children may be not getting what they need to be happy and to be successful and to be stable. And that we do need the help of the community to let us know about those situations and to provide foster families and volunteers and mentors for the children that we serve.
Okay. I think you should do a community night. Once in a while. I think if you guys announce that, hey, we're doing community night, and anybody just come around and ask questions, and I think that will increase the friendshipness. I would say, yeah. That's
something that we have looked at doing. We've had community conversations prior to COVID, so that is definitely something we're looking at doing in the future.
Okay. And kind of sort of finally kind of want to talk about a little bit about the adoption process that you guys service too. So tell me a little bit about that.
Well, a lot of the children that we serve who are adopted are first fostered, and they are adopted by their foster parents. We do have a number of children who are awaiting adoption who are a little bit more difficult to place. Maybe it's because it's a large sibling group that we want to keep together, or because they're teenagers, or because they have a medical issue or perhaps a behavioral issue. And those children are the ones that we try to more aggressively try to look for adoptive parents.
Okay.
And anyone who is interested in adopting a child with special needs can take a look at our website, and they'll be able to submit an inquiry form there.
Okay.
To see some of the children who are listed there.
Okay. What is that process like?
Basically, you can take a look at the website, submit an inquiry form, then meet with one of our adoptions caseworkers and express an interest in adopting a child, and we'll do a home study and try to see if that's going to be a possibility.
What do you hope my community to take from our discussion?
I hope that they realize that we are a partner with families, and we are very respectful and appreciative of all different cultures, and we need their help to provide opportunities and ensure the safety of the children that we serve.
And I want to say thank you so much for taking the time to come. Thank you so much for taking the time to reach out. And if there's any last minute you want to add too?
Well, if anyone wants to have any additional information about our agency and the work we do, they can feel free to take a look at our website, which is childrenservices.franklincounty.ohio.gov. And apart from that, I'd just like to thank you for having me.
No, thank you so much for taking the time, and we'll leave with that.
Okay.
Thank you.